Hello, everyone. Welcome to yet another installment of Free Lunch. My name is Kim Kariuki, and I'm joined by the one and only Mr. Ken Geshinga. Ken, say a big hi to everyone.
Hi, everybody. Great to be back on a fantastic episode of Free Lunch. Last week's conversation got me really thinking, and I got some very good feedback on the conversation around skills and how are we preparing our youth to be competitive in this world. What was the feedback from your side, Kim?
Similar to yours, Ken, I think the truth of the matter is now everyone's trying to think about this youth employment bulge. In some aspects, has been exacerbated by the fact that COVID-19 is running amok in Kenya, in African economies, and across the world. So everyone's really salient on the need to identify lasting solutions, sustainable solutions. The development space now is talking about resilience and adaptability so that companies, MSMEs, the youth can actually gallop forward and make gains in spite of a different and difficult economic environment. And that sort of speaks to our topic for today, Ken. Do you want to introduce it for us?
Yeah, indeed. There's been obviously COVID has been the dominant theme. I think 2020 will be remembered for COVID-19 and the coronavirus, and it's affecting us in so many ways, not just from an economic perspective, but even from a healthcare perspective. And everybody is, as they say, you're either infected or affected,
Correct.
because it's really becoming one of the things that's it's really starting to hit home. And I guess when it started, from my perspective, I remember just driving down Riverside Drive and tuning in to the BBC, and I would get these weekly briefings about what's happening in China. And it seemed so distant. It seemed, I mean, obviously, I still empathized with what the Chinese were going through, but it felt sort of something happening in another world.
Right.
Came to Kenya on March 13th. I think it sort of sank home that it's here.
Yeah.
And we have to sort of be able to adjust to it.
Yeah.
And right now, the president will be having a session on Friday, tomorrow, to really discuss with the governors how prepared are the counties in terms of bed capacity, in terms of capability. So I think for today is really to dig deep into really how COVID has really affected our healthcare system, and what are the things that we can learn from this experience in terms of improving the system.
Very salient points, Ken. I completely agree. And I think one thing that would be, important, and we cannot overemphasize, is the fact that, this has been a global crisis, and without an end in sight, everyone's been trying to play catch up. Everyone's been trying to think about, how best to respond, how best to flatten the curve, how best to sustain and ensure livelihoods continue. There is a glimmer of hope in some of the new virus vaccines that are coming up in the UK from different studies, but those could be a couple of months away for sure before being implemented at scale across the world. So everyone's really flying by the seat of their pants, and I think it makes a lot of sense for us to talk about the sort of state of the health sector. And you alluded to a few things there, what the president will be talking about in a few days' time. But from your perspective, Ken, where have been the successes and the challenges in the approach so far?
Well, personally, for me, let me start with the challenges. The model that the Ministry of Health is using, this is the model from Imperial College London. And this is the model that was designed by Neil Ferguson. And it's the model that many countries are using to be able to project the infection rate. It's a Bayesian model. And the Ministry of Health last week said they have a scenario in which in January next year, they expect 41 million Kenyans to be infected by COVID. Now, for a population of about 47 million, you're talking well over 85% of that. And I raised this issue on a TV discussion yesterday. First of all, are we getting these models right in terms of projecting? Because that number sounded astoundingly large, and I have a lot of experience with Bayesian models because it really depends on how you plug in sort of like the local variables.
Correct.
And everything. And this is the model that is guiding everything from restrictions to movement. This is what the president and the COVID response team are using to be able to guide. So for me, I just wish we'd get a bit more statistics on that model perspective, because so much of our decisions are being anchored on that model, just to get to be able to interrogate that model a bit more. I think for me, the successes is obviously it's put a pause on our lifestyles, and it's given us an opportunity to collectively reflect on the state of the world, the state of the country, the state of healthcare, and there's a lot of engagement on where we need to be. So I think it's sort of press that pause button, and everybody has to think hard about solutions. It's very rare you get those kind of moments where globally you all are sort of like thinking hard. So I think maybe the silver lining of this, we'll get fantastic ideas about solving many other things that maybe we've always maybe not fully tackled. How about you?
I like that. I would agree as well. In terms of successes, I'd say from the first case on March 13th, incidentally, it was my anniversary. And, you can imagine we had, and actually a 10-year anniversary. So we had planned to have, a dinner, go out, enjoy. Then all of a sudden, the reality of COVID hits. I think, people have certainly adjusted their behavior, their habits. Folks, it took a while. The first couple of weeks were difficult. People were still doing crazy things. There were still a few anomalies of people locking themselves in bars and such to continue drinking post curfew hours. But over the while, people began to slowly change. People began to become a little more sensitized in the need to wear masks and protect themselves, social distance, wash hands, especially as campaigns from the MOH and others, NGOs, the president himself, and some of the COVID ambassadors that were the first few survivors of coronavirus. So I think there's a good march around behavior change. I think, though, in the last couple of months, we've seen, a bit of fatigue setting in. So people are realizing that, wait, when does this end? It's not clear. So behavioral fatigue starts checking in, and people start pushing back and wanting to resume their lives. And within that pressure, the president had to reopen the economy and say, okay, guys, take care of yourselves, take care of each other, practice preventative measures, but go about your business. And leading up to the conversation or the announcement tomorrow, it's anyone's guess which way things will be pivoted, which way things will pivot. But I think you're absolutely right about the modeling. I remember my limited experience with doing models. It was always whatever initial conditions you set, whatever variables you assume to be your initial primes for the model will significantly affect the outcome. So I totally hear you on what you're saying on that. If you get some of the assumptions wrong, or if you take certain things for granted, or a certain infection rate or transmission rate that may be true in other places, but maybe not true in Kenya, you can end up distorting the outlook. And I think then that has further complications on how the health sector responds. And so when you think about doctors and you think about insurance companies, and even in the more recent news, we've had a whole bunch of challenges around them, the providers themselves getting access to PPEs and masks and being sufficiently resourced. There's been questions around facilities. Do they have enough beds? Do they have enough equipment to even handle a surge? And so in terms of the challenges, there's been a high level of improper procurement / challenges and leakages in disseminating resources, both personnel and financial, to the county level to ensure that the facilities are adequately staffed to prepare for cases. And I think, in the background of all of that, there's the health system generally, more broadly, has been thrown into a state of disarray. And it's a shame, because this is the one time you need everything to be working, and when we don't seem to be firing at all cylinders, as compared to other countries in Africa like Rwanda, where they're really being touted for having been innovative and taken the hard decisions early to maintain the pandemic effectively.
In terms of, as you said, we talk about the healthcare system, and I like how you compare it with Rwanda, which is a much smaller economy, much smaller country, but they seem to be moving forward very well. And there was that always that broader theme of the universal healthcare, which has been one of the big four.
Yeah.
And which I know even countries as far as the Japanese as Japan would really be invested in Kenya having that system. What's your thinking? I've been involved in a few conversations on, and I remember the time I was at a panel and people are asking, should we go the American private healthcare approach, or do we go to the UK's, Canada's socialized medicine? And personally, I think at that moment I talked about a hybrid model where you'd have sort of entry-level conditions being catered for by the public sort of like insurance, then sort of like more specialized elective procedures being able to cater for those kind of conditions. But those are the conversations right now, because people are going to hospitals. Obviously, they have to deal with insurance. So that whole financing of healthcare and how that works, I think it's such a big topic right now.
I hear you. I totally hear you. And I think the one thing that needs to be appreciated in all of this discussion is the fact that there are no easy answers, but I think I'd agree with you in terms of the benefit of having a hybrid model, because what you're seeing now is a scenario where on the everyone's scrambling, and we don't have enough capacity either at a public level or at a private level. I think the government needs to come in a lot more strongly and say, this is how we are going to manage COVID as a country, and get the medical practitioners aligned and the community aligned on how it is that they want to do this. So on the one hand, there is a place for the government to tell the private insurers that honor COVID-19 related claims, and the IRA has done that, but there's still mismatch in terms of what's happening on the ground. Some insurers are honoring it, some insurers are not, and that's causing further confusion and stress to a system that's already fairly overwhelmed and inundated. And there was, I don't know, there's a piece in the newspaper more recently, I don't know if you had a chance to see it, Ken, of a young man really being bounced up and down from hospital to hospital because he was suspected having COVID. A test hadn't been done, but all the private facilities that he was trying to get to and public facilities that he was trying to get to were full. So, the poor guy was going up and down. Nobody had a place to admit him. And of course, by this point, when you're symptomatic and now you need oxygen and other things, there are other greater concerns around just your life. Are you going to actually be able to pull through? So he was struggling. He needed oxygen. He needed this. He needed that. Finally, there was a positive story to it that he found a place where he could get treated. But then the insurance company came back and said, no, actually, we're not going to cover because we're not covering in a private sector, in a private hospital. So then, you're adding insult to injury and having, a patient now having to think about where is he going to find money to cover a hospitalization bill.
Wow, that's such a difficult place to put somebody in. And that's the difficult choices Kenyans are having to make every day. And we saw the same case with the local celebrity last weekend, who passed on in a car park, of a hospital. So, at the end of the day, quality healthcare needs sustainable financing. And I've always said, as you said, this is where the public healthcare needs to kick in very, very strongly in terms of being able to cover these things. But, the question goes back, how do you get that funding into the system? And for me, that has always been where a lot of people get lost in that conversation. How do you raise consistent funding to be able to fund quality public healthcare across the country? Should we do like maybe what other countries do with the education model, where you have property taxes from a particular area funding the local hospital? For me, I've always thought that's a very viable way, and it sort of incentivizes people to invest in their own hospitals. But that's the big question. What do you think of that in terms of sources of funding consistently our public healthcare?
Yeah, it's such a big issue, and I think part of what we may have to do and dig deep as a country and ask ourselves critical questions is, how do other jurisdictions pay for their medical care? So is it that counties are required to raise internal revenue to take care of their hospitals or their hospitalization? Is there a place for private-public partnerships? The challenge that I sort of see now is because health is still a fairly centralized function, it's still coordinated centrally, there is a whole space where our teams on the ground can't make critical investment decisions because a central planner somewhere has to decide for a particular county, this is the healthcare budget allocation, and priorities are more or less top down. And I figure if there was a lot more agency across the different counties, I can see county heads deciding to prioritize certain interventions. So I'm thinking of like a Dubai model, where they say this particular part of Dubai has been zoned as the health city, so we're going to work with public partnerships to set up state-of-the-art cancer testing, screening, research institutions. Another part of the county or another part of the city can be designated to be the education city. So I think it does require a bit more imagination, and I think it is possible, and I think there's enough inertia and goodwill for it. The challenge is that the system has already inside it a lot of inefficiency baked in, a lot of leakages, a lot of opportunities for misappropriation of funds. And so we have a scenario where the funds, the decisions aren't being made as effectively, as efficiently as they can.
I think you've raised that issue of accountability, which is a very big thing. And for me, when I think of applications of technology such as blockchain, I think this is an area that, because insurance generally, fraud is always a big problem, but even county management. And I'm just thinking, because healthcare is a devolved function in Kenya. And one of the problems counties have had is raising funds for themselves. But the Constitution allows them to apply to be able to collect rates, land rate from their citizens. If we could have a technological infrastructure that makes assessments on what's the property value in this county and the neighborhood, what is the percentage land rates that's owed to the county, and that money is through mobile money, it's all transferred with almost very little human interface. And when it gets to the county health minister, it's very easy to see how it's being disbursed. Is it in buying medicine? Because counties right now have said they want to buy. They've been having a lot of challenges with KEMSA, the medical supplier, to see whether they can buy their own medicine. But for me, I think the fact that we've never solved that part of how do we raise the funding, and for me, I think if you look at most countries, it's mostly through property taxes that they're able to fund quality education and quality healthcare. And unless I think we get in that space, I don't know if we'll ever get a consistent source of revenue, because VAT, income tax, all these other things are sometimes can discourage people from coming into that locality. And because people would be like, I rather work in a different county. But the fact that property taxes, they're physically there, and the people are invested in that area, personally, I feel as a country, we really need to look at that direction.
No, you're right. And, thank you for that clarification. Yes. So yeah, health is a devolved function. However, I guess my point was more around something like an approach to disaster preparedness like this. On the one hand, I fully agree, requires, a nationalistic approach. You can't necessarily have an effective strategy when 10 counties have closed up, another 20 counties maybe are not sure what they're doing, and then the remaining 17 counties are waiting to see what the first 30 counties do. So you do need some level of coordination. But then the more, of course, this is somewhat easier said than done, but I feel like there's definitely a place where the individual counties could, aside from the issues to do with, governance and effective community participation, ensuring that there's better institutionalization of the devolved structure as a whole. I still feel like, if you think of some designs like the Konza Smart City was part of Vision 2030 and others, there were certainly, some underlying thoughts, initiatives, and, perhaps ultimately, over time, some of the investment already put into these mega projects will be paid back through property taxes, etc. I would even say that even if we just took a few counties and looked at our own internal capacity, 2-3 days ago, the Equity Bank, one of the big banks in Kenya, donated a whole bunch of PPEs to 2 particular counties to help them shore up their disaster preparedness and coping mechanism. So I think it's definitely possible for, even beyond thinking around changing tax code. Ultimately, I think we all agree that, we would need to figure out more innovative ways of fundraising. But I think even at the very basic level, with the resources we do currently have, is it a question of reappropriatization? I was listening to the ongoing budget discussions and challenges in a few counties in Kenya, and it seems like 70% of the current budget is on overheads and staff costs, and only 30% is on development. And I always sort of wonder, is that the ideal mix? You talked about technologies like blockchain and others. Are there ways to leverage technology more to shift that ratio? Because I think there are certainly, there are no easy answers to be had for sure, but I think it's time that we start having those tough conversations now, because, at the end of the day, if we don't put the contagion under control, if we don't put the lid on things, then there'll be nothing to save.
No easy answers indeed. Maybe one of the assignments we can give ourselves and our listeners too is to look at maybe 3 countries that are considered to have high healthcare quality, and look at how those countries fund them. And report on the same next week before the next topic. What do you think about that?
I like that idea. So that's a very good opportunity for us to wind down the conversation and to give ourselves and our listeners the opportunity to weigh in and tell us what we've missed, what we need to think about, what we need to do differently, etc. And so with that, I think, we can... Yeah, go ahead.
Parting thoughts from you?
Parting thoughts, I think we need to continue to take care of each other, take care of our families, keep safe, practice social distancing, and at the same time, be your brother's keeper, even as we wait to see what decisions will be made on Friday in terms of the continued state of affairs. It's really important for us to really begin these conversations with from an informed perspective and hopefully create a dialogue that engages public health and private health stakeholders around, what's the place for the health system? How can the health system support Kenyans? What's the role of private and public insurance? How can those two organs contribute to an effective national strategy around COVID so that we don't have weird instances where individuals are not getting covered or not getting treatment even though they have coverage, or they don't get treated because the coverage that exists is insufficient for the need.
That's a very good parting shot. I think from my side is, again, to really look at how other countries are dealing with this. And I could say maybe what is the indicator of the country with the best healthcare? Is it the lifelong longevity? And in that case, I guess Japan and possibly Germany have that. And I know we did get funding from Japan to work on our universal healthcare. So I think I'd be very curious to see what Japan and Germany, how they have tackled this, because obviously there is more to health than longevity, but I think it's one important criteria in being able to say this is a healthcare system that works.
Correct. Couldn't agree with you more.
Awesome.
Great. I think that's our time, everyone. Thank you so very much for listening to us. Please reach out with your questions, comments, feedback, and we will look forward to answering them and picking up this conversation again in our next podcast. All right. Cheers, everyone.
Bye-bye.
Bye.